Good morning. Bob Ravenscroft, the Vice President for Advancement here at Bryan Health. It is the media briefing for, Tuesday, May 18th or May 19th here. I want to start out by just thanking the Nebraska Air National Guard. The flyover yesterday, it's a pick-me-up to our staff. It's a pick-me-up to, I know, our colleagues at St. Elizabeth's, and I think for the entire community to get outside and see that. They said they were doing it to demonstrate support for healthcare workers, but again, you guys are all an extension of our care team right now, so I hope you took some enjoyment out of that and grabbed a little piece of their gratitude for yourself as well. I think it fits into something I shared yesterday. I'm going to take just a moment to talk about yesterday we talked about the phases of communication and why we would back down to 3 days a week. The Center for Disease Control publishes a crisis and risk communication booklet, and in it gives pretty prescriptive measures to follow through the 5 steps of a pandemic. And there's pre-planning phase, an initial phase, the maintenance phase that we mentioned yesterday, which is followed by a resolution and an evaluation stage. Frankly, we're going to be in this maintenance phase until we get better contact tracing, better testing, and eventually a vaccine for COVID-19. And, that'll be some time. I think everyone's aware of that. After you get to that phase, that's when you look back and do some evaluation. So I know in the past, through some of your questions, we said, it's difficult to say who's right or wrong until you get to that phase, and that's some time off. I'm sharing it because it's, I think, going to be important for your readers, your viewers in the media, certainly for us, for our patients and our employees, and essentially every member of our community to kind of know what is facing us as we go through this maintenance phase. We know that people are going to experience some numbness to this, some denial, grief, anger, perhaps despair and hopelessness, and frankly, it's understandable. I've mentioned to my family when they asked how the day was, and I said it's kind of like Groundhog Day. Every day is the same, so there's an element of numbness even for us. And then we read the social media comments that are posted on some of your stories, and it's difficult to understand why people won't mask, and some are still considering this false and a hoax, and it can frankly lead to a little despair and hopelessness when we evaluate what can we do or say to be a little bit more effective. We pretty quickly recenter, because when we share these daily stats for us at Bryan, they're not really a leaderboard of, a sense for us. They represent some very sick people, some gravely ill folks. Families are impacted, and none of this is to minimize the other societal impacts as we make decisions to reopen up. But it certainly impacts people besides us in healthcare, and each individually it impacts us differently. And I just want us to be cognizant of that as members of the media, as healthcare providers, members of the community. During this maintenance phase, I suspect frustration will likely heighten for almost all, as it takes a while to get back to normal. But that's kind of where we're at. So here's what we can do and what we'll continue to do, even though it's going to drop to 3 times a week. It's important for all of us to acknowledge the fears and the shared misery that we all have. It's not restricted to people of certain ages or socioeconomic classes or what side of the political aisle is on. We all have some fears and some misery in this. It's important to let people know what to expect, even if it might impact them negatively. For our world, it's certainly the visitation policies, the information on elective surgeries and those decisions. As we prepare for a second surge, we will be open and honest with you about that. And, like anyone, we wish we knew more and our answers were more definitive. So it's going to be important for all of us to update and inform you on how to mitigate risk, encourage the support for recovery efforts. This community has responded so strongly to this point. There's going to be some things that are going to require us all to respond, not just for your healthcare system, but for others in the community that have been negatively impacted. It's really important for all of us to correct misunderstandings and misinformation and rumors, and we do understand that we, like others, will experience sustained scrutiny and sustained interest in COVID-19. So again, we'll continue to bring you the briefings, again, dropping to 3 times a week starting next week. We'll ramp back up if necessary. And it's important for us in healthcare, certainly I think the media and whoever you are in the community, to value the feedback. So from the media, from the public, we are here to absorb your feedback. We're listening, and we'll constantly assess that on how we can provide the best information possible as we go through this. Again, I think this maintenance phase is going to last until you get to the resolution, which means vaccine, so it'll be a little prolonged. Real quickly, before I hand it over to John, our midnight census was 425 last night. We have now administered 7,609 COVID-19 tests, resulting in 1,019 positive results, and we are down to 251 pending, so things are coming in a little more quickly. We did have one advanced question. We'll address that after John speaks, and send in your questions. Thanks.
Thanks, Bob, and thanks for those clarifications as we prepare for the maintenance phase as we move forward. So we have 28 positive COVID patients in-house, 13 from Lancaster County and 15 from outside of our county. We have 2 individuals that are pending results in-house as well. 10 of these individuals are on ventilators, 11 are in our intensive care unit, 5 are in our progressive care unit, and 12 is in our general care unit. And as Bob said, we're giving you numbers here, but always remember this is an individual behind each one of these numbers. So I think that's always important to keep light of, that we're here about taking care of individuals and doing what's necessary to get these individuals back to normalcy and back to their homes. With that, we'll take any questions via chat.
It'll be interesting to see how this develops. Obviously, people are going to be comfortable or less comfortable with the privacy issues around that. I have seen, stories on other parts of the country where they are doing this and it's effective. It'll be interesting to see how it works because, if we're treating a COVID patient, will the geolocation from the app notify all 5,000 Bryan employees that they've come in contact because we're in the same building? So I don't know the details and the nuances of it. I think things like that could be very well received by some folks. I think it would have to be done in a way where it doesn't create undue fear and anxiety for folks. But indeed, it could be effective. It'll be interesting to see what this product of being referenced in the question is and how it's plugged into the national and state databases to see if it's effective.
This is why we talk about the importance of getting results back as quickly as we can, because those are shared with the health department. Then the health department does the tracing. And the quicker that they can get those results, the quicker they can get in with that individual and any contacts that they may have had, and then take the appropriate action of self-isolation and so forth with these individuals. So that's extremely important. This app will be interesting to watch because, when somebody tests positive for COVID and then they go through treatment in a series to when they have 2 negatives, they're then no longer positive COVID patient. So how would that app take that away from that individual? We don't want a person to be labeled for life as a positive COVID patient because people recover from this. So it'll be interesting to see how that interacts once it's up and running, and especially when you're talking about an area that's as large as we have in Lincoln and the bigger cities. It'll be interesting to watch how that works out. But we constantly talk about getting results back quickly, and I can't express to you guys how important our health department plays a role in this, in the working together of our government officials, the hospital systems, working with the health department, because if this isn't a team effort, we're not going to be successful. And I think we have been successful in this part of the country because of that collaboration and the working together with all of these different agencies and individuals of trying to stay on the same page. And it's difficult to do, because we've been used to working independently. But I think when people understand this is about individuals' lives and this is our job is to take care of the public, that you're really seeing some good outcomes and collaborations between all these individuals. So as you can imagine, a hospital of our size, we have a number of ICU beds. But what we've developed in our plan is how we will stage and grow in the number of ICU bed capabilities. So as we had shared with you before, we have the capacity to have 160 some ventilators here at Bryan. So we could increase ICU capacity as the demand requires us to do that. And right now, we're not in that situation to where we need to open up other units to an ICU capacity. A lot of patients that are on, or the ones that are on ventilators are in ICUs. The other ones are in progressive care units or they're in isolation units that we've established with negative air pressure.
Our midnight census was 425. That's the highest it's been in a while. It's an indication of the pent-up demand for some of the electives that were delayed that are now safely being done. And then I think it's just a reminder that the 160 plus vents that John referenced, yes, we modified some machines and did some different things. Actually had a couple of donated to us as we were in this initial phase of the pandemic. But Bryan is equipped to deal with people that are on ventilators and require our team to wear personal protective equipment every day of the year. We always have patients in some form of isolation, but obviously we made provisions to ramp up if needed because of COVID. But I just don't want people to lose sight of that, especially as they consider, is this a safe place to come and receive care for some of the elective things or things that they've been putting off? It is. We are accustomed to dealing with highly contagious things year-round. This one obviously is a little different, but it is safe to receive care here. The kind of the 3 S's we've talked about screening, separation, and safety, they're hallmarks of every decision that we make here, and we can separate the COVID and the non-COVID patients. Anecdotally, we've heard some things, and we just want to stress to people, again, with those 3 S's, there's an element of screening / testing for every patient now before they receive care. There's separation in the facility, even how they enter and how they are triaged in the facility, and then everything's done with safety in mind. So if people are out there and they have been putting off emergency situations, we implore them not to do that. We can keep you safe and separated when you're in the facility.